YouTube, and welcome to tRNsform. This is Harmony, and thanks for tuning in. So today's video is going to be on a very important subject. It's how do you pass nursing school, some study tips, and then also test taking tips. So let's just dive right in. So the very first thing that I would like to say is NCLEX questions. Those are going to be the most challenging thing when it comes to nursing school, because I talked about this in one of my other videos that like NCLEX questions, they don't require straight up memorization. They require critical thinking. They require applying the knowledge that you learned. So a lot of times, some of the very best nurses were not the best nursing students. And like what I mean by that is, so I was always really good in clinical. Like that was my jam. Like I loved the hands-on interaction. But lecture, I always kind of like I'd pass, but it was never with like super flying colors. Like I would get it. I would understand it, but it was like doing the questions that always had like the hardest part for me. So after my first semester or so, I went to my mom and I was like, my mom's a nursing professor. And I was like, Mom, like, help me. I am having like this super hard time. And she's like, are you doing NCLEX questions? And I was like, yeah, of course. She's like, other than your test? I'm like, no, I'm not. She's like, I want you to do 20 questions a day. And I was like, are you out of your mind, woman? She's like, no, like just do it like 20 questions a day, Monday through Friday. So 100 questions a week just to get used to it. And I was like, she's like, you don't have to do them like, you know, the same topic. It would be helpful, but just to get used to like the idea of like what they could ask. Because there's only so many ways to ask a question. I mean, you know, like a beta blocker is going to reduce the blood pressure and it's going to reduce the heart rate. And there's only so many ways you can ask a question, like a patient has a heart rate of 40, you know, and blah, blah, blah. And the doctor prescribes a beta blocker. Like, what do you do? Like, yeah, you're going to question the doctor because you're going to block that dude down into like 20, make him have a full blown, like complete heart block. And then he's just not going to have a pulse, and that would be bad. Let's not kill our patients. That's always rule number one of all nursing questions. Don't do the answer that's going to kill your patients. So going off of that, how I do when I have like my NCLEX style questions, the very first thing I do is I read the question and I like look and I try and think like, what's the answer? So before I even get to the answers, I try and think like, do I know this? Do I have a gut feeling about what the possible answer might be? So then I'm like, all right, yes or no. If I do, then I see if that answer's in the ABCD choice. If I don't, then I go and I jump into the question. So then I look at like the first one and I kind of say like, is this, you know, an answer? Is it a potential answer? So if it's a potential answer, I might put a question mark by it. If it is like a definite answer, I'll put a star by it. So a lot of times at the end, I'll have two that are just totally out, and then I'm down between two choices. So it's like 50-50, you know, and the, you know, who wants to be a millionaire? I'm like, all right. So I've already used the 50-50. Now I'm like, well, is there a phone a friend option? And you're like, nope, I'm in a test. So what do I do now? So now it's like, okay, you've got your two choices. So it's like, what is the better choice? And that's where the ABCs come in. Airway, breathing, circulation. So very first thing to think about is what is going to kill your patient first. And it's a gruesome way of thinking, but study like your patient's lives depend on it, because you know what? They do. There's so many times when you are that final, like you're the final wall. A doctor will give you an order and then you have to be like, real world application here, like, is that a good plan? So, NCLEX questions, ABCs, you know, airway, breathing, circulation. And then last is study tips. So what kind of learner are you? I'm a visual learner. I found these phenomenal comics online. They're called medcomics and they're a visual learner. If someone shows me how to do it, I mean, like I own it. If, you know, just you got to find out what kind of learner you are. There's like so many tests out there. You can figure it out. Some people are going to be more audio learners. If you're an audio learner, like totally ask your professor, can I record your lecture? And then like listen to it on your commute. Or, you know, if you're cleaning the house, you can like put your earbuds in, like vacuum. You know, that would be super helpful if you're an audio learner. And if you are like a hands-on, like demonstrate learner, one of my friends was like, the only way she could study was she had to rewrite all of her notes. And like, I'd look at her and be like, Rachel, like, seriously? She's like, no, like, this is how I do it. And she would write her notes out, like, in class, and then she would rewrite them. And like, she would like have the book while she was doing it. She's like highlighting and stuff. I mean, her notes were like a work of art, but that would have never worked for me. I could read the book all day long. If there's no pictures, I'm out, man. It's not gonna work for me. So like, last but not least, I know it's a little bit of like a tangent, and I've been tangenting the whole time, but when you're studying, just please prioritize your health. When I was in nursing school, I actually gained 30 pounds. Like, I know it doesn't sound like a crazy amount, but I was in a 2-year nursing program. That's like a hell of a lot of weight. I went from being like this really in shape running girl to like a not so in shape person. It was because I wasn't sleeping. I wasn't eating right. I was like living on like, you know, crap, like cookies and pizza and all this awful food just to like keep myself, you know, going. So I've since like lost the weight, and you know, maybe someday I'll do a video about that. But what I would strongly recommend is like, keep yourself healthy. You know, I know it sounds crazy, but I love baby carrots. They are a great snack when studying. They don't crumb. They're relatively easy to eat, and like your fingers aren't sticky afterwards, so you can keep like doing whatever you're doing. So I'm a big proponent of like eating veggies and stuff like that, or like fruits, or just really healthy foods, because it's gonna fuel your body. The vitamins are gonna help. You're gonna just feel better, and never compromise your sleep. I can't tell you how many nursing students I would see would pull all-nighters. So like, the test is, you know, Wednesday. Like study the Wednesday before, do like a little bit, and then like Tuesday night, try and go to sleep actually like earlier than normal and get like a full night of sleep, because you want your brain to be on the ball. The last but not least thing, I know I talked about, you know, like going through with the questions, the NCLEX questions and stuff like that. Trust your gut. Always trust your gut. And I will tell you this as a nurse, I cannot tell you how many times trusting your gut is going to save somebody's life. His life is going to depend on it. And that's all, folks. So thanks for watching my video. Make sure to subscribe if you liked it. Press the button below, tRNsform nursing, and seriously, don't forget to trust your gut, ABCs, and keep transforming yourself every day. Thanks for tuning in, and thanks for watching.